Hi, Miss.
Now, how are you, Ale? How is everything?
Fine. How are you, Miss?
Fine, thank you. How was your day? How was yesterday? I think you were so occupied, right? You were busy.
Mm, yes, but my computer has a virus.
Oh, that was the problem. Yeah, I remember now. So, did you have a chance to watch the video, or did you practice any other way?
Yes, I was reading a little of grammatical.
Okay, that's so. What time do you have in your watch, please?
Sorry?
What time do you have in your watch?
Um, 6 o'clock.
Okay, just a minute and start, okay? Let's just wait for your classmates.
Okay.
So how is the weather there?
Today is sunny. How is
Okay,
it in La Paz?
here it was sunny too. Today, yesterday was kind of sunny, but on Monday, it was the worst rain I have ever seen here. I don't know if there was any other kind of rain like that, but here it was full of thunders. I was a little bit scared.
Mm,
Yeah, it was so scared.
it sounds like, I don't know. So, um, how could I say ruidoso?
Noisy.
So noisy. Thanks, Miss.
It was no problem. It was so noisy. That's why I was a little bit scared because here, of course, it rains. It's La Paz, right? It
Mhm.
rains, it is sunny, maybe it's cloudy, I don't know, windy, but I never heard that kind of rain. But I thought it was because it was so hot the day before. Maybe that's why. Okay, dear Ali, let's start, okay? Well,
Okay.
I will read this part in a way you can get the way you have to pronounce the words, okay? And then we will have a chance for you to read, and we will make some chances for both, okay? Well, continuing with the topic we were talking on Friday, we have affective disorders. This is an extract from a medical textbook, okay? So, affect and mood are similar in meaning and refer to the emotions. For example, happiness and sadness. Affect, the word affect, tends to be used for temporary emotions and is expressed through manner of speaking, facial expressions, or behavior. Okay, that means affect. And mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression. The symptoms of while are poor appetite or significant weight loss, sleep disturbance, for example, insomnia, inability to sleep, or fatigue, that is a loss of energy. Then we have a psychomotor agitation, that is excessive movement and thought, or psychomotor retardation, that means slowing of movement and thought. Of course, we can have loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. 5 or possible 4 of the above symptoms occurring nearly every day for at least 2 weeks constitute a major depression. Okay, so I think you can get a little resume of this extract, right? Did you get the text?
Yes,
Or
Miss.
do you have any questions here?
And no.
Okay. Do you have any kind of opinion about this? Maybe another symptom or sign that you can mention for depression, for example?
I could say that depression is common in these days because the COVID, because don't people can't do the same things than before.
Yeah, that's true. That's true. Okay, Ali, can you read this part for me, please?
And yes, neurotic and stress-related disorders. Behavior syndromes associated with physiological disturbance such as eating, disorders of adult personality and behavior, for example, personality disorder, mental retardation, delayed mental development, schizophrenia, and other disorders in which there are delusions, false beliefs. Is it schizophrenia?
Right. And the correct pronunciation might be schizophrenia. Almost the same in Spanish, right? Just inia.
Schizophrenia, sorry, I didn't hear that.
Okay.
Is
Schizophrenia.
schizophrenia.
Schizophrenia. Since you have the S at the in the first place, you have to pronounce schizophrenia. Like there were no other word here. Okay? Schizophrenia. But if you find some word with an E before the S, you can mention S. Okay? But here, in Spanish, for example, we have schizophrenia, right? But in English, it's schizophrenia. Okay?
Okay.
Okay. So we have here psychological. It's almost the same in Spanish. We say psicología o psicológico, pero se escribe con PS, ¿no es cierto?
Yes.
Here is the same, just PHY, psychological. Okay?
Okay.
Okay. Do you have any questions here for vocabulary?
What is delayed and development?
Delayed mental development. It's like retardation of the development, the mental development. Un retraso en el desarrollo mental. That's why mental retardation. Delay, it's a synonym, almost as in a synonym of retardation. And delayed, of course, is in past tense, right? But it's almost the same.
Oh, thanks, Miss.
No problem. So we have this kind of neurotic and stress-related disorders. Behavior syndromes associated with psychological disturbance, such as eating. We have anorexia and bulimia, right? We have disorders of adult personality and behavior. For example, personality disorder and mental retardation, since we heard of that, that is a delayed mental development, and schizophrenia, and the disorders in which there are delusions. That means false beliefs, right? Where the patient is not in time and space at the moment, is thinking about lots of things in his or her mind. That's why we call a false beliefs. Okay.
Okay.
Then we have the symptoms of depression, as we were talking before. For example, which symptom of depression was this patient suffering from? We're gonna see this case. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She has lost of interest in most things. She has sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. So do you think those are symptoms of depression?
Sorry, miss.
Do you think those symptoms are from depression?
Mm,
Most
maybe
of them?
it could be hypothyroidism too,
Okay, okay.
or hyperthyroidism. It says she doesn't lose weight, I think.
That she had lost interest. No, where is it? She was Thursday. She was eating normally and her weight was steady. Yeah, it was like she was losing or not weight. So it's kind of weird, right? So you have to do maybe some tests of hyperthyroidism
Yes,
to diagnose, right?
we could ask hormones levels.
Okay, to make a differential diagnose, right?
Yes.
Then we have the nervous system, sensory loss. The central nervous system controls the sensory and motor functions of the body. Disease of this system therefore lead to loss of some of the functions. Okay, and we have here functions. When we lost these functions, we will call it that name, and other symptoms related. For example, for hearing, if we lost this function, it would be deafness. And other symptoms will be buzzing or ringing in the car, like tinnitus, right? We call it tinnitus. For the sight function, if we lost it, it will be blindness. And other symptoms could be double vision, what we call diplopia, or blurring, that is a loss of visual acuity or clarity of vision. Okay. Then we have sensation or feeling with our hands, right? Or any other part, but most with our hands. The loss will be numbness or anesthesia. Okay. And other symptoms will be tingling or pins and needles. That means paresthesia. Okay, then we have function, the balance function. And if we lost it, would be unsteadiness or ataxia, okay? And other symptoms will be dizziness or vertigo. We have a note here. There are no common words for loss of or conditions relating to taste and smell. For example, now with COVID, if we lost the taste or smell, do you know any word that you can use to call this loss or not? Or you just call it loss of taste and smell?
I think it is in Spanish, or I could say it in Spanish.
Okay, try.
Em, para la pérdida del sabor podemos decir ageusia, si no me equivoco.
Okay. And for...
Y para la pérdida del olfato, anosmia.
Okay, so in English will be almost the same. There is no variation in some words that are like, sorry about the noise, that are like proper names that we call like Alejandra or Misheel. In medicine, we commonly use the same names, okay? For example, ageusia or anosmia, it will be the same, but it's good. Do you have any questions for vocabulary here?
Yes, what is zinc? Is synonymous zinc? Zinc?
Where is it?
The first line.
The first. Bazi?
Yes.
Okay. It's a noise that you heard like tinnitus, like a zumbido.
I get
Will
that.
be the translation, okay?
And what is blurring? Blurring.
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 Blurring. It's when you have your vision, when you cannot see very well, you see a little blurry, borroso.
Thanks, Miss.
Don't worry. Do you have any other question here?
Tingling is paresthesia.
Tingling or pins and needles, paresthesia. It might be more like adormecimiento. Let me check. Right, hormigueo. That's why the description, pins and needles, right? It is almost the same feeling.
Thanks, Miss.
You're welcome. Any other thing? Can we continue?
No, that's all.
Okay. So we have here motor loss. Can you read this part, Ale, for me?
Yes. Motor loss. Weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, usual manner of walking. Speak may also be affected, for example, with hoarseness, a dog, deep voice as in vocal cord paralysis. Slurred means poor articulation as in cerebellar disease.
Okay, so that's good. So do you have here the words and the meaning of these words? There is something that you didn't understand?
What is closet?
Where, where is it?
Mm, at the last part.
Where is large, right?
Mm, yes.
Okay. Poor articulation, as in cerebral disease, slur. We're gonna find out the correct translation. Okay. If we have hoarseness, that it might be um, a rough, deep voice, as in vocal cord paralysis. Slurred means poor articulation. When you are speaking, you have this problem that you cannot articulate a word. So you are slurring the words, like arrastrando las palabras. Slur, arrastrar, okay? Because hoarseness, it might be like ronquera, when you cannot speak, right? It was understood, Ale?
Yes, miss.
Okay, let's continue then. And we have a loss of consciousness, right? Where patients may describe sudden loss of consciousness in a number of ways. And we find here some texts that patients may say, I passed out, right? Like here. Or I had a blackout, or I fainted. Those are almost the same, are the same to express a loss of consciousness, like here, okay? Or I had fits, I had seizure, I had a convulsion. Fit, seizure, and convulsion are all used to refer a violent involuntary movements as in epilepsy, okay? Do you know the word in Spanish, maybe, to describe this kind of attacks, involuntary attacks?
Como tónico-clónicos, digamos, ataques
Yeah,
de epilepsia.
yeah, that is the meaning of fit, seizure, and convulsions are used to refer a violent involuntary movements as in epilepsy. Okay, and doctors may say, when did you lose consciousness? And the patient will explain to you when, how, what was she doing in that moment, or maybe if she takes any medication, right? Do you have any questions here?
No, miss.
Okay. And here is a passage from a textbook on the causes of loss of consciousness. Here, the principal differential diagnosis is between an epileptic fit and a syncopal attack or fainting syncope. Is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished, from a seizure principally by the circumstances in which the events occur. For example, Syncope usually occurs whilst standing under situations of severe stress or in association with an arrhythmia, sometimes a convulsion and urinary incontinence, or loss of control of the bladder. Occur even in a syncopal attack. Thus, neither of these is specific for an epileptic attack. The key is to establish the presence of or absence of prodromal symptoms or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people might get a warning known as an aura. That attack is going to happen. Note, the noun convulsion is often used in plural form. He had convulsions as a child. Okay, that is a little note. I want to know if you understood this reading and if you are agree with the text, with the content.
Yes, I agree with the text, Miss.
Okay. Do you think, do you have the same word, aura, to relate with that little time when convulsions will start, maybe? Did you read about that? Do you know something about that?
Yes, I talked to patient who relate me the symptoms.
And what did she say?
That she saw like lights before the attacks.
Okay, that's interesting, right? That might be that moment, aura, right? Okay, that's interesting. Let's continue then. Okay, Ale, can you read this part, please?
Yes, the motor system. Examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue, look for signs of wasting muscle atrophy, muscle tone, amount of tension in muscle when it is relaxed. Tone can be increased, spasticity, or decreased. Placidity, muscle power, strength, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflexes, CB below. Involuntary movements, for example, a tic or a tremor. Here is an extract from a case report about a patient with a tremor. Case safety. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had generally increased muscle tone. Power, reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stopping of turning.
Okay, thank you, Ale. Here, just that, muscle, okay, instead of muscles. Muscle, bulk, amount of muscle tissue. That is the meaning. Look for signs of wasting. That means muscle atrophy. Muscle tone. That is an amount of tension in a muscle when it is relaxed. When we find a word like this, relaxed, here, we pronounce just like that, not relaxed or not decreased, just relaxed, like a little T at the end, okay? Here to decreased. For example, where we have, I was reading first, relaxed, right? Yeah, increased, okay? Just that for the pronunciation. A tone can be increased, that means spasticity, or decreased, that means flaccidity, okay? Muscle power, strength, coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Do you understand the word gait? We have any way to
No,
describe.
miss.
What? Can you repeat?
No. No, I don't know what is gait.
Okay, the manner of walking. When you have a patient and you are making an examination of this type, you usually watch if the patient is conscious of the time, of the year, right? Maybe some questions like that. And you ask him or her to walk, right? And you watch if he or she has some trouble walking. And you are looking for a gait, the manner of walking. Maybe in Spanish, we use that expression like marcha or paso, because gait is paso, but we have a taxi gait, right? Like in Spanish, and some other kinds. Then we have reflexes. When we saw reflexes, you were telling me that your patient saw some kind of lights before, right? Reflexes are almost the same with lights, okay? Involuntary movements, for example, tic or tremor. Do you understand the word tremor?
Yes, I think.
Can you tell me in English or describe the word? Try. I know you know.
Like a repetitive movement.
Okay. Okay, that's good. Involuntary repetitive movement, right? That's okay. So we have here tendon reflexes. Then examination of the nervous system and normally includes testing the tendon reflexes. For example, the knee jerks with a tendon hammer, also known as a reflex hammer. Do you know, right? With a hammer, you just push the ankle and it moves. Do you remember? Did you do that examination, that test?
Yes, miss.
Okay. Also known as a reflex hammer. Oh my God. Before I told you about the lights, it wasn't that at all. I'm just confusing the word, okay? Reflexes in this case is using to know the movement, if wait, if the nervous system is working well. Because if you do something like push, for example, you involuntary will respond to that movement, okay? So it is a reflex, okay? Like in tendons. For example, the knee jerks, what we were saying before. The reflexes may be absent, no, nothing at all, like zero, diminished, like negative way, normal, a plus way, or risk, more than normal, okay? The plantar reflex are also checked. The normal plantar response is a downgoing, like going down, a movement, plantar reflection of the big toe, an upgoing, a toe extension or extensor of Babinski response is abnormal. Maybe you have studied that. Maybe it's the name of the response. I don't know if you heard about Babinski, extensor of Babinski.
Yes, miss. It is normal in babies.
Okay,
Recién nacidos,
newborn.
newborns. Yes, it is normal in them.
Okay, can you explain a little bit of that?
It's like extensions of the fingers.
Extensions of the fingers.
Yes, of the feet.
Okay, of the finger toes, a movement contracting and reacting of the finger toes,
Yes, something like that.
or just this thing, this exercise with the toe, right?
Like that.
Okay, okay, very good. And we have the coma. Coma is an unconscious with a reduced response to external stimuli. Doctors say the patient is in a coma, or may say the patient is comatose. Both definitions are okay. The Glasgow Coma Scale, or GCS score, is calculated as follows. Eye opening, spontaneous, like 4, to speak, 3, to pain, 2, and none, 1. Verbal response, oriented, 5, confused, 4, inappropriate, 3, and incomprehensible, 2, and none, 1. And motor response, obeys, 6, localizes, 5, withdraws, 4, flexion, 3, extension, 2, and none, 1. It's just a remembering, right? Because I know you know that, or you use sometimes, someday, I don't know. Do you have any experience using this box or this scale?
I didn't see this in practice, but in the class, yes, I see that.
Okay. I don't know if you have any questions here.
Yes, withdraws.
Withdraws. It will means like retiro. Okay. Maybe if you do something like punching with a needle, the patient will do this at that time. And that is the normal thing, right? That is how the motor system responds. But if he do anything at all, okay, that's a problem. He doesn't feel anything. Is it okay?
Yes, miss.
Perfect. Okay, so we have finished this part, but we still have time, and I wanna start another part. Okay, so okay, Ale, we're gonna talk about another topic. I don't know if you have any any experience with oncology? If you have any patient, you know someone who has this kind of problems or diseases?
No, miss, I don't know anybody who has this problem.
Okay, but you treat someone or you saw treating someone who has this disease? No, not at all.
Yes, maybe, but I don't remember a specific case at
Okay,
this moment.
okay, so you will remember maybe this part. Ale, can you read this paragraph, please?
Yes, oncology, neoplasm. Neoplasm is an abnormal new growth of tissue. Malignant neoplasms cancer are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors say growth or tumor. You have a small growth tumor in the bowel.
Okay, that's good. Just a little thing, spread. It's just like that. Do you understand this word?
It's like metastasis or
Yeah, it could be used. The real meaning is propagar, but another way to say it is metastasis, right? Because it's almost the same. So you were no so far of that. Then we have here tumor, okay? Nothing else. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there are other causes such as inflammation or fluid accumulation. And patients may say, I have a lump in my left breast. And doctors say there was a firm, palpable mass in the liver. Okay, so do you understand the word lump or swelling?
no miss.
Okay, a lump might be used, what in Spanish we say bulto, right? That is why the description says maybe due to a neoplasm. And a patient can say, I have a lump in my left breast. That's how they go to the doctor, right? And the doctor has to say, okay, there was a firm, palpable mass in the breast, for example. But that is a lump. A swelling is something inflamed, okay? Both could be used as a collection of tissue or fluid which is visible or palpable and can be palpated or felt with the fingers. So you can touch and say, okay, this is swelling. It's big, okay? Did you understand?
Yes, miss.
Perfect. Can we continue? Or you're writing down?
Yes, please, we can continue.
Okay. Then we have a malignant tumors are characterized by rapid growth and invasiveness. The tumor, the tumor may invade local tissue or may spread to distant parts of the body, and that is a metastasis. Okay, neoplasms, which are the result of a metastasis, are called secondary. as opposed to the original tumor, which is the primary. Okay, so we have one tumor and might be the primary, and the metastasis might be the secondary tumors, right? We have a note here. To invade, that is a verb, is to enter and spread throughout a part of the body. And this process is invasion. That is a noun, okay? If a tumor is described as invasive, it has the ability to spread. Just to write down for grammar. Okay, can you read this box, please?
Yes, we have the results of the scene back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of spread. So if we remove it, there is every chance of a complete cure.
Okay, thank you. Here is, we have the results of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be at an early stage and there is no sign of a spread. So if we remove it, there is every chance of a complete cure. Okay? Do you understand here or do you have any questions?
No, miss.
Perfect. We have symptoms and signs of malignancy. Can you read this part, Ale?
Yes. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space-occupying lesion in the brain causes intracranial pressure and symptoms such as headache. How I can...
Vomiting.
No, headache.
Oh, headache.
Uh, thanks. Vomiting or visual disturbance. Tumors of the colon may obstruct, block the lumen, and cause change in bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss.
Okay, thank you. Obstruct. And the meaning of obstruct is block. Okay, you won't go left to pass something. Okay, so do you have any questions here?
No, miss.
Perfect. Signs to detect early stages of cancer. We have unusual bleeding or discharge, change in bowel and bladder habits, a sore that does not heal, nagging, cough and hoarseness, decrease in weight, obvious change in mole or wart, indigestion or difficulty in swallowing, thickening or lump. Do you have any questions here?
Yes, what is thickening? Thickening or lump?
Thicken.
In the last part.
Okay. It's like espesamiento. Do you remember we talked about lamp just in the last slide? Like a swallowing, a lump on my breast, for example.
Yes.
Yeah. Okay, that is a thickening, an espesamiento, abultamiento, something like that. In every area, in anywhere. Okay, you can see the image. I know it's so little, but you can see a little thickening or lumps. Okay.
Yes. Thanks, Miss.
No worries. Any other question?
And yes, what is hoarseness?
Do you remember we were talking about hoarseness? You didn't write down?
No, Miss, I don't remember.
Okay, we're going back. Oh, it was on the other slides. I'm sorry. Okay, so where is it? Hoarseness. Hoarseness is when you have some problem speaking. You make the words so rough, like, do you remember now?
Yes, I remember.
What was the word?
I I forgot, but we talk about that.
Okay, but I want you to know, ronquera. In nagging is like a cough, a chronic cough. It's all the time. You're coughing all the time. Persistente, nagging cough. Okay, and
Yes.
hoarseness is ronquera. Okay,
Thanks, Miss.
don't worry. We have here a case. Can you read this case, please?
Sure. 33-year-old man present to his GP complaining of painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 um, kilograms
Yeah.
in weight. He was also complaining of night sweats. He had no significant past medical history.
History. Okay, here, sweats. He was also complaining of night sweats. Do you remember what was sweats? Like,
I thought it was sudar.
yeah. Do you have any question here?
No, miss.
Perfect. And we have the treatment of tumors. A tumor can sometimes be completely removed or exist by surgery. If this is not possible, for example, if it has already metastasized, the other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. Chemotherapy, okay? When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Do you understand the text?
Yes, miss.
Do you have any questions, or we are good here?
We are good.
Perfect. Let's continue then. And we have this beautiful part. The last part was a little bit poor people. Here we have pregnancy and childbirth. Okay, the expected date of delivery, we can use the letters EDD in English, is the date on which a woman is expected to give birth to the child she is carrying or pregnant with. It is calculated by adding 280 days or 40 weeks to the first day of the last menstrual period that we will use these letters L and P. Okay, childbirth is also referred to by doctors as parturition. Okay, childbirth is also referred to by doctors as parturition. So another way to say childbirth will be parturition. Delivery is the process of helping the child to be born. Spontaneous vaginal delivery, SVD, is a normal delivery or a natural delivery. If there are complications, the baby may be delivered by cesarean section or surgically removed. Okay, so do you have any questions here?
No, Miss.
We have a lot of topics to talk about tomorrow, right?
Yes.
Oh, perfect. Okay, a full-term pregnancy is 40 weeks, divided into 3 trimesters. A baby who is born before this is premature, and one born after 40 weeks is post-mature. A baby death, for example, because the umbilical cord is around its neck, is stillborn. A pregnancy may end before term spontaneously with a miscarriage. That means miscarriage means spontaneous abortion, or be deliberately terminated with an included abortion. That means termination of pregnancy. Okay, note, the verb induce means to cause something to happen. Okay, so do you understand the context of this text?
Yes, Miss.
And do you have any questions?
No, no, Miss.
Okay. Let's continue then. We have the labor. Can you read this part, please, Ale?
Yes, Miss. Labor is the process by which the fetus and placenta are pushed out of the uterus. It is divided into 4 stages. Some words which are combined with labor are premature, prolonged, spontaneous, induced, false labor.
Okay, thank you. Remember here, divided is okay. In some words, we can use divided, just pronouncing ed, okay? But some of them, like combined, we have to use a little t at the end. Don't forget that. For example, premature, prolonged, right? Spontaneous, induced, unfalse, okay? Another word, pushed here. I know that when we use the present tense, we say push, but when it's a past, pushed, not necessary to say push it, okay? Pushed, just that to practice. Do you have any other questions of vocabulary here?
No, miss. Just the pronunciation. In which cases I have to pronounce the ED or in which cases I don't have to.
Okay, we have the regular verbs, lots of them. I don't know exactly the number of the regular verbs, okay? But the only way to know how to pronounce them is just finding a way to listen those verbs. But in this case are regular verbs. I will try to find some program or something like that that helps you to pronounce the correct ways of the verbs, okay? Because it's just practicing. There is no a rule specific for the pronunciation, okay?
Okay, miss.
Okay, so let's continue. We have 3, 4, no, we have a lot of them. Okay, we will left here the slides for the next class, okay? And I will ask you, please, to fill my little questionnaire. I don't know what happened with your classmates. I miss them.
I don't know.
Okay. Yeah, thank you. I don't know either. Just Lily, she told me that she couldn't do it, but I don't know what happened with the other 2 ones. Okay, so see you tomorrow. You're gonna be the first one. Is it okay for you?
It's okay, miss.
Okay, see you at 6 then.
Yes, see you later, miss. See
Take
you
care,
tomorrow.
Ale.